There was no hospital in the Mid-Coachella Valley, so in the late 1960s, longtime seasonal residents Bob and Dolores Hope were motivated to build one. They donated the original 80 acres, and then Mrs. Hope got very serious about fundraising. She started the auxiliary and began raising money to build this hospital. But they needed a name. With the help of Ambassador and Mrs. Walter Annenberg, they approached President Eisenhower. President Eisenhower agreed to lend his name, knowing that the Hopes, the Annenbergs, the Firestones, and others behind the project had promised to make sure it would be a place of excellence in health care. The enthusiastic group put their money where their mouth was, enlisted their friends to help, and a hospital was born. For more than 40 years, Eisenhower's footprint has grown and encompasses a 130-acre campus in the heart of the Coachella Valley. It's the only not-for-profit medical center in the Coachella Valley. We're very proud of this, and we're proud to be mission-driven, not dollar-driven. Eisenhower has maintained its capital expansion over the years to accommodate population growth in the valley. This includes a hospital with a 540-bed capacity. A portion of this has been built to be seismically sound. Even in the face of economic uncertainty, Eisenhower-Medical-Center is determined to stay strong and dedicated to our healthcare mission, to serve the changing healthcare needs of our region by providing excellence in patient care with supportive research and education. Eisenhower Medical Center is focused on redefining the Valley's healthcare delivery system by filling the need for physicians in the Coachella Valley and simultaneously addressing the national physician shortage. We'll be recruiting and hiring primary care physicians in internal medicine or family medicine, including doctors who specialize in HIV primary care. There's a shortage of more than 100 internal and family medicine doctors in our community. Many times when people call to see a doctor, they're told that they cannot get in for 4 to 6 weeks. This has resulted in an increase in emergency room and urgent care center visits. Several years ago, our board made the commitment to put their sights as well as their philanthropy into establishing Eisenhower as a teaching hospital. One of the goals was to reduce the physician shortage while developing a responsive primary care practice model. By building the patient-centered model of primary care delivery, over the past 2 years, Eisenhower has made some significant headway on 2 main fronts. Over 35 outstanding new physicians from prominent institutions such as UCLA, the University of Southern California, the Cleveland Clinic, and others have been recruited to see patients and to serve as teaching faculty for the residency programs. While Eisenhower was busy recruiting new physicians, it was also building the foundation for its School of Graduate Medical Education to become a teaching hospital. With full accreditation granted in November of 2011, Eisenhower is the 25th medical institution in California to be granted accreditation for a new School of Graduate Medical Education, offering residency programs in the primary care areas of internal medicine and family practice. Of the 5,800 hospitals in the country, only 365, or 6%, are teaching hospitals. Data from around the country indicates that approximately 68% of medical residents remain in the area where they do their residency training. Eisenhower will welcome its first residents in the very near future. Shortly thereafter, Eisenhower will have its full complement of 55 residents in the primary care area. Funding needs are significant. These funds will support resident scholarships, clinical research, faculty recruitment, facility remodels, and patient outreach for wellness initiatives and outpatient services. Over the next decade, we envision a wellness-based health system to train top physicians for the medical challenges of an aging population, more effective patient and physician communication using technology, and wellness and prevention-based medical practices and clinics. For example, our primary care patient practice model is using new communication technologies for effective patient interactions. Relay Health is a web-based tool using a secure server that offers patients and physicians online interactions. We've seen success and acceptance among patients who use the tool to ask their doctor questions and for online access to medical records and prescription refill requests. Philanthropic support will allow new pilot studies in better electronic and standard communication systems, giving patients relative ease of physician access in a 12 to 24-hour time span for non-emergency situations. With the help of philanthropy from the 30,000-foot view, Eisenhower intends to focus on primary care physician training to respond to the growing national physician shortage crisis. Eisenhower is governed by a prestigious board of trustees who originate from many different states because most of them live here seasonally. In their other places of residence, they serve on prominent boards as well, such as the Cleveland Clinic, Chevron, University of Pennsylvania, Hewlett-Packard, and more. This board provides an extremely valuable cross-fertilization of ideas and opinions, resulting in a leadership of courage, vision, and deep fiscal responsibility. The board has produced a well-planned, progressive transformation of Eisenhower Medical Center. Healthcare is exceedingly complex. Achieving new objectives is only possible with a strong foundation of the most important element, excellence in patient care. Our Performance Excellence program keeps all employees focused on our mission. We've built upon this foundation to move our organization forward by providing better service in a couple of areas. One area of focus is electronic medical records. This is a wired system with access to all patients' records that are available throughout Eisenhower's health system. As we've expanded to serve our community, we've enabled better communication and efficiency through the use of implementation of digital record keeping. We are also developing long-term plans, both in capital expenditures and improvements, as well as physician and medical staff recruitment. We discovered we could only provide a network of primary care physicians to our community by expanding beyond our main campus to bring our facilities closer to our patients by building outpatient clinics on the east and west ends of the valley. One of the most effective measures of our success is our Press-Ganey scores. These patient satisfaction scores measure all areas of inpatient and outpatient care. For more than 25 years, Press-Ganey has been the industry's recognized leader in healthcare performance improvement, working with more than 10,000 healthcare organizations nationwide, including 50% of all United States hospitals, to improve clinical and business outcomes. Since contracting with Press-Ganey, we have worked to move our percentile scores to the 70th percentile or higher. For the past several years, our scores have been consistently in the 80th and 90th percentiles, with some departments logging in at the 99th percentile. These surveys help us to monitor where we are achieving excellent patient care and where we need to improve. Another metric for measuring our success is through our annual Gallup Employee Opinion Survey. In 2011, Eisenhower-Medical-Center received the Gallup Great Workplace Award. Gallup, the world's best-known and most respected behavioral science authority, surveyed nearly 15 million employees from around the world and awarded only 29 companies with the prestigious honor in 2011. Winners span the globe and represent all facets of business, from healthcare and hospitality to retail and manufacturing and more. According to Gallup, Eisenhower Medical Center is among the winners because its results demonstrate one of the most productive and engaged workforces in the world. One of our goals at Eisenhower is to recognize and award employee, volunteer, and physician performance excellence. Each month, coworkers, visitors, and patients nominate employees, volunteers, and physicians who've gone above and beyond to make the Eisenhower Medical Center experience outstanding. A panel selects winners for the 5-star service commitments for our patients and guests in the following categories: safety, clinical excellence, courtesy and caring, healing environment, and efficiency. All the nominees are invited to a monthly breakfast. Eisenhower's executive leadership attends each breakfast to congratulate the nominees and winners and provide an update about what's occurring throughout the medical center, on and off campus. Many people don't realize that Eisenhower has developed 4 centers of excellence: cardiology, oncology, neuroscience, and orthopedics. They reflect the most common healthcare needs of the population segment that we serve, which is people generally age 50 and above. For more than 23 years, Eisenhower has been the only not-for-profit provider of adult daycare to Coachella Valley seniors with Alzheimer's disease and other organic brain diseases. Licensed for 35 participants on a daily basis, the goal of the 5-Star Club's programming is to keep patients mentally and physically stimulated by offering personalized care plans and a range of activities. The 5-Star Club also hosts weekly 2-hour caregiver support groups. Many people are not aware of the 2 new units at Eisenhower. The Center for Geropsychiatry, the only program of its kind in the desert, is a comprehensive and compassionate inpatient center that provides an extraordinary level of personalized care and support designed exclusively for people aged 65 and older who need help returning to a healthier mental and physical state. We have an entire team of experts who are focused on each individual's unique situation and needs. We've also recently opened a new inpatient rehabilitation center for patients requiring intensive therapy after a stroke or other debilitating medical condition. We provide 3 hours of therapy a day with 24-hour rehabilitation nursing care in a beautiful healing environment. Prior to opening our 23-bed center, there were only 12 inpatient rehabilitation beds in the entire Coachella Valley. In spite of the problems we're encountering due to the recent economic downturn, Eisenhower continues to support a dynamic and growing community benefit program. We provide a comprehensive series of community health education classes at our main campus, as well as at our satellite health centers in La Quinta and Palm Springs. Eisenhower organizes and hosts support groups for patients with a wide variety of health issues, including Alzheimer's, Parkinson's, stroke, and others. We subsidize health services for both Parkinson's and Alzheimer's and are involved in economical and educational partnerships with the desert communities. Eisenhower has extensive involvement with College of the Desert and the University of California, San Bernardino in providing clinical rotations for nursing students at no cost to the students or the schools. Eisenhower also provides financial support to help educate registered nurses and offers a new graduate education program for newly hired registered nurses as well. Eisenhower-Medical-Center is very proud of the many accomplishments it's achieved over the years, from being acknowledged as one of the nation's top 100 hospitals to receiving the Gold Seal of Approval for total hip replacement and total knee replacement from the Joint Commission. The Distinguished Hospital Award for Clinical Excellence and Patient Safety is an accomplishment that we are very proud of. One false perception is that we are a wealthy hospital. In reality, Eisenhower is the only not-for-profit medical center in the Valley. Over 70% of our patients are on Medicare. Moreover, we've recently experienced an increase of $16 million in unreimbursed Medicare costs, bringing our total Medicare shortfall to $66.4 million in 2011 alone. The amount of charity care we provide has increased 154% over the last few years, which translated to $28.4 million in 2011. The figures for the medically indigent and Medicare patients' shortfalls are also at record levels. As a not-for-profit organization, Eisenhower has been dependent upon philanthropy, which has been severely impacted by a struggling economy. Unfortunately, the Coachella Valley doesn't have large corporations that would typically be a source of philanthropic revenue. We rely instead upon individual donors, and while we are grateful for all of them, our funding is not often as consistent as long-term corporate donations tend to be. However, given the recent economic downturn, hospital census have been down nationwide, and our valley is no exception. In the past 2 years, in particular, we have experienced a drastic reduction in our hospital census, even during our peak seasonal winter months. Eisenhower has a vision to change the way healthcare is delivered to the Coachella Valley while becoming a model for other healthcare institutions. The establishment of Eisenhower as a teaching hospital and school of graduate medical education is a direct response to this vision. We want to train a new generation of physicians and focus the entire healthcare community on research and innovation. Becoming a teaching hospital strengthens Eisenhower's ties with academic medical centers and increases the opportunities for cutting-edge research and collaborative work. With the impending retirement of a generation of physicians, and with fewer physicians specializing in primary care, Eisenhower has prioritized its teaching hospital efforts on primary care services. Recruiting more primary care physicians who can be trained in primary care specialties, specifically internal medicine, family medicine, and geriatrics, lays the groundwork for building the healthcare organization of the future. This new venture is historic and fundamental to Eisenhower's commitment to maintain medical excellence by expanding its primary care physician services to serve Coachella Valley residents and beyond. We are incredibly thankful and grateful that you have chosen to review our history, our growth, and what we hope to accomplish in the future. In addition to the many programs currently in operation, such as our School of Graduate Medical Education, the opening of new clinics across the Valley, physician recruitment, and the support of our local nursing programs, we continue exploring new ways to serve our community. One of our dreams, which we could incorporate as part of our residency program, is the establishment of a clinic in our East Valley to provide medical services to our indigent and underserved population. A facility like this would not only serve a great need during devastating economic times, it would also provide our physicians and residents with a place to practice medicine for those who might not have the opportunity for medical care otherwise. These programs benefit everyone involved, strengthening ties in all areas of our community. I invite you to come visit Eisenhower, meet with our CEO, and get an up-close and personal look at all that we're trying to do to see if there may be areas of interest to you where you could make a significant difference in the lives of so many for generations to come. Thank you very much for your time and attention.